The day we do the patient's surgery, it's an anxious day for the patient. They've never had eye surgery before, and they're not really sure what's going to go on. Even though we prep them and tell them what's going to happen, they're just not really sure. But things tend to be very, very positive, very nurturing. People tend to feel very comfortable once they get in the surgery center. And that's a testament to our staff. Once they are in the operating room and we're ready to go with their cataract surgery, obviously they're laying down on a table, and your surgeon will be sitting next to you. We sit down while we do this, and we'll kind of be sitting by your ear. The patient's awake during the procedure. They're breathing on their own. You're not unconscious. You don't have a breathing tube put down. That type of invasive surgical techniques are not necessary with this, which kind of helps make the procedure be as safe as it is. But you are awake. You will have already been anesthetized, so you're not feeling anything on the eye or around the eye. The anesthetic also numbs the vision too. So one of the things that makes people nervous is they think they're going to see the doctor kind of come at them with surgical instruments. But the anesthetic also kind of numbs your vision, so you don't really see what's happening. So if you don't feel what's happening, you don't see what's happening, you don't really know what's going on. And the procedure is a quick one. It can take 10 minutes or so to remove the cataract and implant your new lens, so it really does move quickly. During the procedure, we can have a conversation, and it kind of surprises people that I am talking to them and they're talking back to me. And what goes on there is relatively organic. I don't have any particular thing I say to the patient other than, you're going to do great, we're going to get things started. If the Buckeyes had just won the national championship the night before, we're talking about the Buckeyes. If there's a big thunderstorm happening while we're during their procedure day, we might be talking about the weather, or we could be talking about your grandson or my child, or whatever. So by the time we're finished with our little discussion, I'm telling the patient, we're all done with your procedure, everything went great. They tend to be astounded that it's all done. We see you out in recovery where you're sitting up and you do have an eye patch over your eye for a few hours after the surgery, and the patients tend to be in great spirits. They get a little snack afterwards. They get a cookie or a cracker and something to drink, and they tend to love that. The snack tends to be a fun part of the day, but it's a very unique experience, and even though we tell the patients how it's going to go, it's something that you really don't understand until it takes place to you. But the experience tends to really be a positive one. When I see the patients the next day, they tend to have a lot of compliments for the staff. They tend to be impressed at how the procedure went, and they tend to be very thrilled with their outcome, even less than 24 hours after the procedure. What's really amazing about how we do this procedure is that we operate through tiny incisions. We make two of them. One of them is 1 millimeter. Look at a ruler. 1 millimeter is very, very small. The other incision tends to be maybe 2.5 millimeters. Again, very, very small. The trick to the procedure is to remove this cataract, this three-dimensional object. It tends to be about 12 or 13 millimeters wide. It tends to be about 4 or 5 millimeters thick. So that's sort of a big object being removed through a small incision. So in order to get that big object through a small incision, we have techniques where we break that cataract apart, and we break it into particles and aspirate it through the eye. So we've gotten the big object out of a small incision. So the next trick is getting a big object into the eye, which is our lens implant, through the tiny incision. So the really neat thing about these implants is that they are flexible, but they also have what's called memory, which means you can bend it or fold it or change its shape, but then it restores to the position or the shape that it should be in. So the neat thing about how we implant this lens is that we kind of fold it up and roll it up like a burrito, and it's put into a tiny inserter. The inserter is small enough that it can fit through our small incision. And so we inject that lens into the eye in the shape of a burrito, and then it unfolds with its memory to its proper shape. And then, of course, we manipulate it and position it inside the eye exactly where it needs to go. But that's the trick of getting a big object out and another big object into the eye while operating through such a tiny, tiny incision.